What is diabetes? Diabetes is a metabolic disorder caused by the deficiency of the hormone insulin or because of the inability of the body cells to use the available insulin. There are two types of diabetes. First is type 1, that is insulin dependent, which usually occurs in young age. This is a severe type and usually it is not controlled by oral drugs. One has to take insulin injections. Sufferers of this type of diabetes are only 5% in India. Second type, or you can call it non-insulin dependent diabetes. This type 2 diabetes occurs usually at the age of 40 and above, which can be controlled with suitable changes in the diet and lifestyle, with or without hypoglycemic drugs. Few points to be noted. Type 1 diabetes is caused by gradual destruction of insulin producing cells of the pancreas, initiated by proteins of cow's milk when given to an infant at the early age of less than 1 year in place of mother's milk. Type 2 diabetes is produced by insensitivity of pancreas in producing insulin due to aging, maybe obesity, lack of physical activity. Exercise plays an important role in its production. In case of type 2 diabetes, if diet alone is not sufficient, one should try some home remedies. First is bitter gourd. This vegetable is an effective anti-diabetic food and should be included liberally in the diet of a diabetic. The bitter gourd contains a hypoglycemic or an active principle chartin, sometimes called plant insulin. Taking fresh juice of at least 2 bitter gourd daily in the morning gives enormous benefits to the diabetics. Second in the list is fenugreek seeds. Fenugreek seeds contain trigonolline and an alkaloid known to reduce blood sugar levels. It can be consumed by soaking seeds in water overnight or in powdered form with water. Usually 25 grams of fenugreek seeds should be taken. Third is curry leaves. Curry leaves are little bitter and aromatic. Curry leaves possess the quality of herbal tonic. They are a food of great value in diabetic problems. 10 fresh leaves to be taken every morning for 3 to 4 months. The leaves can be grinded into paste and taken as chutney. Fourth is Indian gooseberry. Amla fruit is probably the richest known source of vitamin C. Gooseberry is an ideal food for diabetes. A tablespoon of its juice mixed with a cup of fresh bitter gourd juice, if taken daily for 2 months, will help in reducing the blood sugar in diabetes. It may also prevent one from eye complications. Fifth is jambul fruits. Jambul fruit is another effective home remedy. The seeds contain a glucoside jambulin, which checks the conversion of starch into sugar. The seeds should be dried and powdered. 1 teaspoon of this powder should be mixed in a glass of water and should be taken twice a day. An equal quantity of amla powder, jamun seeds powder, and bitter gourd powder also makes a very useful remedy for diabetes. A teaspoon of this mixture taken once a day would be quite effective in checking the progress of the disease. Sugar in any form, sweets, chocolates, rice, potato, banana, arbi, grapes, mangoes, parathas, puris, pakoras, dalmot, dry fruits, oils, cakes, and pastries, cereals and fruits that contain high percentage of carbohydrates and fat are contraindicated. There should be control over the quantity of food as well. Walking is appreciable. Walking increases insulin efficiency by raising the number of insulin receptors in muscle cells. Exercise is important in controlling sugar levels. Light games, jogging, and swimming are recommended. Yogic asanas such as Bhujang Asana, Shalbhasan, Dhanurasan, Paschimothasan, Sarvangasan, Halasan, and Shavasan are beneficial. Symptoms. A diabetic may feel hungry and thirsty most of the time, gets tired both mentally and physically, may suffer from anemia, constipation, intense itching around the genital organs, palpitations, and general weakness, and has a lower sex urge than normal person. The content in this video is for educational purpose and is not a medical advice. Please consult your doctor. Please like, share and subscribe. Thank you for joining.